Mark. Tonight in Medical Rounds, a national task force recently announced guidelines for doctors to screen all adults, especially pregnant women and new mothers, for depression. And that's exactly what the Peripartum Mood Disorders Program at the Institute of Living at Hartford Hospital is all about. Art Guerra is an advanced practice registered nurse and director of residential and adult outpatient services at the Institute of Living. He's joining us live now to explain more about this program. Nice to have you here with us tonight, Art.
Good evening, Denise.
Well, tell us about the Peripartum program, and just so we're all on the same page, how is Peripartum defined?
So in this particular instance, we're really looking to treat moms ideally before they might become pregnant, during the pregnancy, or even after pregnancy. So it really attaches that entire time frame from before the pregnancy to the 9-month period, and then to up to 6 months or even after that time period.
Good to know. Now, who would be at risk?
And we're looking really to, well, the folks that are moms that are at risk, usually 10 to 20% of our population of mothers are at risk for a peripartum mood disorder. And certainly folks that come from disadvantaged backgrounds, or moms that might have a previous history of depression, might be more at risk and really need to be aware of the need for evaluation and treatment if they start to become depressed during their pregnancy.
Well, how do you treat a pregnant woman who's depressed?
Well, certainly there's several different options. For some moms, really supportive groups might be helpful. Also, psychotherapy could be helpful. But for moms that have a more severe path of depression, they might really need medication. And that's where I think the Hartford Hospital Institute of Living program comes into play. We have APRNs and physicians that specialize in working with mothers to go through a really focused risk-benefit analysis so moms can make a good decision on what they want to do if their depression has worsened and medication might be an option.
All right, Art, we have time for one last quick question, but I think it's an important one for any pregnant woman who's out there. How do you know when it's time to seek help for depression?
That's an excellent question, Denise, and I think the bottom line is a mom knows inside when things have changed. When sleep has changed, energy has changed, thoughts have changed, your mood has changed. When your husband or significant other notices this, a lot of times moms try to soldier on. They might have a beautiful child with the expectation of others that they really are doing wonderful, but inside, if you feel that your functioning has changed and you know that you have a problem with your mood being more depressed, you're crying, you're not able to sleep, these are all warning signs to seek counsel from your obstetrician or getting an evaluation in a program like we have.
Thank you so much, Art Guerra. Great information, and we appreciate learning about this important program. Now,